Um, Before we start with the actual presentation, I'd like to go through a few things on our Adobe Connect classroom. And I'd like to invite you to join us next month, December or January 30th. I'm already in the wrong month, not only the wrong year. We'll be talking with Wesley Valdez from Intermountain Healthcare, and we think we're going to be talking about some new things coming up with IHC. We've not been able to contact Wes lately, but we know we've got a good presentation coming up for you. And we also want to remind you to visit us at the NRTRC Regional Telemedicine Conference in Portland, Oregon. That'll be March 24th through 26th, 2014. We always have a great time up there. We have a lot of information, a lot of networking, and a lot of good opportunities for just meeting and greeting folks in the telemedicine industry in our region. I'd like to walk you through our list a little bit here of our Adobe Classroom. You can see the attendees pod over on the far right on the top. It shows you who's in, who's presenting, and information like that. Just below that pod, we've got a files pod. You can download today's presentation in PDF format by clicking on the link in that pod. And you can also download a new updated save the date card for our conference in 2014. You're encouraged to grab both of those. The link below actually links you out on the web to SurveyMonkey, the first one, and we actively ask you to take a survey and tell us what you thought about today's webinar, as well as telling us what you'd like to see in the future. We really want to serve you folks who visit us regularly, so any ideas you have for upcoming webinars, we'd be more than happy to investigate that. Also, we have links to our annual conference website, and I might say that registration is now open. You can get an early bird registration into the first couple weeks of January and save yourself a little bit of money to go to Portland. You can also sign up for our regular mailing list and our newsletter, and then you can take a look at our website. Look fast at the website. We're updating it, upgrading it, and it's actually going to look pretty good. If you want to get a few giggles, you might look at our current website. To the left of that, we have a chat pod. This is where we ask you to put procedural and technical questions about the Adobe Connect situation. As you can see, we had some questions about audio earlier, and that's where we'd like to have information in that pod. And then the Q&A pod. The Q&A pod is for questions for Brad, our presenter, and depending on whether and how fast the questions come in, Brad will answer them as he's running, or he might wait till the end of the presentation to answer them. But he's got video on all the questions, so he'll be able to monitor that. And with that, I'd like to introduce our speaker today. I had to ask him how to pronounce his name, and he said that the R is silent, so I think Bad Wegrzyn is probably the wrong way to say that, so I'm going to introduce him as Brad Wegrzyn. Brad's a media engineer at the University of Utah Healthcare Department of Telemedicine. He got his Bachelor of Science degree in Education from Northern Michigan University, a State of Michigan teaching license, and that was in 1991 and 92, and then completed a year toward his Juris Doctor degree in 2002. From 2003 to 2007, he was production engineer at an NBC affiliate station in Marquette, Michigan. Brad joined the University of Utah in 2007 and has received a Cisco Telepresence Video Field Engineer for Advanced Authorized Technology Provider Certificate in 2011. That must be a 11 by 17 certificate to get all those words on it. His career at the university has included serving on the staff council for developing training programs for the hospital help desk. In 2010, Brad received a prestigious Starfish Award in quality for his auditing process that prevented lost time due to technical difficulties with telestroke, and that's an important step forward. He's also been a frequent speaker for the American Telemedicine Association and the NRT, and Brad has been very, very helpful to the NRT, and we want to thank him for everything he's done for us. He's a very active member of our technology committee. And Brad currently lives with his wife Mary and 6 children in Clearfield, Utah. So with that, Brad, take it away.
Thank you very much. So I'll be presenting today on The House Call is Back and It's Better Than Ever. I blatantly plagiarized that title. It's not my creation, and I'll give credit to it later on in the presentation, but I absolutely loved it because it addresses exactly what I'm going to be covering today. So to begin, I have my standard disclaimer here, and we can come back to that. But like most good stories, the story of house calls has a humble beginning. In the 1940s, the majority of providers saw visits their patients in their homes. The patients never came to the doctor. But in the 1960s, as things changed, house calls were about 40% of the doctor-patient meetings. And then back up to the 80s, that number dropped to less than 1%. So the benefits of house calls is, as you can see here, but the doctors learn more about their patients' lifestyles, eating habits, and their ability to take medicine and exercise. The patients know you're on their turf, and it makes them much more relaxed and comfortable and more willing to answer questions. You learn a lot more things that you wouldn't otherwise, the patients wouldn't otherwise probably feel comfortable saying in the office. In the process, home care is doing exactly what's most needed. It's increasing quality and driving costs down. So the decline of house calls, how come they disappeared? Well, there's a number of reasons. Until the 1940s, the majority of physicians in America saw their patients in their homes, but this meant the physicians would spend the majority of time on the road, and a considerable amount of time would be spent with each family. Not only was the amount of time spent with each patient drastically different, but also frequency of visits was astonishingly higher. Towards the end of the 1920s, American family physicians were making about 3.6 calls for the average illness. The idea of expecting to be seen by a physician multiple times through an illness was considered the norm. This was quite an extraordinary time period for the physician-patient dynamics. While there weren't the same offerings in terms of biomechanical knowledge or more recent technological advances, patients had a very intimate relation with their physician and felt satisfied that way. The taking of time to explain concepts, frequent check-ins, demonstrated empathy. Did well to increase trust in physicians, which has been shown to be inversely related with the incidence of medical malpractice lawsuits. Of American physicians practicing in the 1920s, a high percentage, about 74%, were general practitioners. By 1942, the percentage of general practitioners had fallen below half. This decline continued in the 80s, where only 15% comprised of family physicians. This turned out to be having a devastating effect on house calls. In 1980, the National Center for Health Statistics showed that, in a sense, it essentially became extinct, with 0.6% of patient visits occurring in the home. The trend of declining home visits have persisted over the decades, has certainly played a role in the changing doctor-patient relationship. Whereas once a physician visited a patient in their home, often multiple times for a single complaint, now the patient may be placed on a 10-minute block in a clinic setting, certainly altering the doctor-patient dynamics. So why are house calls coming back? Well, there's a number of reasons. There is a projected increase in number of elderly, consumer demand for it, hospital readmission reduction, where we want to reduce as much readmissions as possible for the same illness. The concept has also had absolute rock-solid bipartisan support. Clearly, caring for people in their homes and keeping them out of the emergency departments and hospital beds will have a positive effect on healthcare spending. The New England Journal of Medicine looked at intervention by multidisciplinary teams in patients with cognitive heart failure to prevent hospital readmissions and found that there was a 50% reduction in hospital readmissions in high-risk patients. According to the Administration on Aging, the older populations, which they consider people 65 years or older, numbered 3.6 million in 2009. That was the latest year for which data was available. That represented 12.9% of the U.S. population, about 1 in every 8 Americans. It's projected by 2030 there will be about 72.1 million older persons, more than twice their number in 2000. People 65 plus represent 12.4% of the population in the year 2000, but are expected to grow to be 19% of the population by 2013. Now, about aging, I remember my grandmother watching TV, and what she would do, she would always turn to me and say, "You know they're dead now." Well, it's funny. I find my wife and I were watching TV doing the exact same thing. Or I hear my father the other day making grunting, groaning sounds when he gets up from a chair, just to realize my father wasn't there. Actually, it was me doing it. So I'm only 47 years old, but as you can see, I am a member of the AARP. So I keep on telling people I'm not old, I'm chronologically gifted. Another thing is I'm life of the party, even when it lasts until 8 p.m. I'm sure they are making adults much younger these days, which seems to be true, at least from my point of view. So what can be used to bring back the benefits of house calls to patients at the same time as address the issues that cause this decline? And I listed the benefits, which we had an earlier slide, as well as the decline. So we come to what this whole presentation is about, which is about WebRTC. WebRTC stands for Web Real-Time Communication. It provides web application developers with the ability to write rich, real-time multimedia applications similar to video chats for the use on the web with no plugins, downloads, or installations required. So where does WebRTC come from? And of course, I have the Swedish chef. I loved him when I was a kid. It actually started in Sweden, developed by a company called Global IP Solutions. It was founded in 1999 in Sweden. In 2011, it was acquired by Google, and the World Wide Web Consortium started to work on standards for WebRTC. So who is supporting the WebRTC project? Well, it's the World Wide Web Consortium, Google, Mozilla, and Opera. Development is supported by other parties with a vested interest in the standard, which includes Apple, Microsoft, Ericsson, Cisco, and countless smaller, real-time communication companies. So what is the goal of WebRTC? WebRTC aims to give the development community access to open, high-quality, real-time communication technologies. And that's important about open. This type of real-time communication technology has only been available to large corporations who can afford the expensive license fees or through proprietary plugins like Adobe Flash. WebRTC will open the door for a new wave of video, voice, data web applications. So to me, licensing fee, that's a dirty word, definitely in my book. So where does it currently work? Well, currently it's supported in Opera, Google Chrome version 23 Plus, or Mozilla Firefox version 22 Plus. There's also some additional ones which I will cover later on in the presentation. So why is it important? Well, it's currently supported, as like I said, by Opera, Chrome, and Mozilla. It is incredibly important because it marks the first time that a powerful real-time communication standard has been open sourced for public consumption. It opens the door for a new wave of real-time communication web applications that will change the way we communicate today. Example, WebRTC video quality is noticeably better than Flash. It uses JavaScript WebSockets, also an HTML5 standard, improves session connection times, and accelerates delivery over all other events. It offers significant improvement in latency, enables more natural and effortless conversation. With WebRTC, you no longer need to rely on any type of browser-based plugins. You can easily customize look and feel and work with the video like you would like any other element on a web page with the new video tag in HTML5. In regards to the penetration, by the end of 2013, in a sense now, it's estimated that half of the internet population will be enabled for WebRTC. That means half of the internet population will use a browser or have access to a browser that will have the ability to display WebRTC. Recently, Google announced that it has over 1 billion endpoints today. That includes over 750 million Google Chrome users. All the Firefox users are enabled, and other browsers will looking to eventually adopt WebRTC. Although Internet Explorer is losing market share rapidly, it is still used by a significant number of individuals in the US. However, the IE10 does not support WebRTC just yet. Latest version, the first time Microsoft has heavily introduced auto updates. What Microsoft Internet Explorer uses a Google window in order to display WebRTC, which I'll get into that in a moment. So, a note on the US connection speeds. Now, I included this because I believe this is important. The average internet speed has increased significantly. Companies such as Google building infrastructure for 1 gigabit connections, speeds are poised to grow exponentially. This is great news for WebRTC as it means faster flights, and I'll get into what I mean by flights in a moment here. Okay, fast growth and its consequences. I'm going to use an example here which happened at the University of Utah. What happened is that we have throughout the university a Wi-Fi infrastructure in which people with their laptops will be able to connect into Wi-Fi and be able to surf the internet. The problem being is that the number of devices that each person brought with them has increasing over the years. So example, it's not just somebody opening up a laptop and connecting into Wi-Fi. It's their laptop, it's their tablet, it's their smartphone, it's their e-reader. On average, the average college student has 3 to 4 Wi-Fi enabled devices. So what did that happen? Well, what happened is that the University of Utah ran out of IP addresses for there. So it says they could connect to the Wi-Fi, but they could not surf because they could not get an IP address. Right now, I know at its peak, it's about 35,000 people connecting to Wi-Fi. So as we grow faster, and going back here, as connection speeds increase, and as we grow, we have to keep an eye on that and plan for the future. So what does WebRTC mean to you? Well, imagine the impact of 1 billion endpoints. As I mentioned before, Google says about 1 billion people right now have access to browsers that have WebRTC enabled or friendly. So 1 billion endpoints. This is the potential amount of endpoints for people to talk to each other and making video conference calls. Even though Microsoft is really pushing Skype for desktop video conferencing, they're also making sure that Internet Explorer is ready to take on the WebRTC challenge. But the missing link right now is, will there be interoperability between WebRTC and other unified communication solutions? I personally believe the first developer that make both words compatible to each other definitely will have an edge. So the impact on your network. So in a sense, WebRTC, we have all of a sudden every computer is a video endpoint. No downloads, no installs, no usernames, passwords, in regards for it to work on their browser. So what do I do? Well, WebRTC does a direct computer-computer communication. In the sense, prior to that, everything was sent to a server, text, audio, video, which added a lot of payloads in terms of network traffic and latency. In a sense, the server acts like a hub in a major airline. Flights stop at that hub and passengers can connect to their destinations. But passengers need to go through baggage claim, immigration, layovers, and delays. However, it's nice and so much faster if you could fly direct. If airlines had direct flights available from your local airport to every single destination in the world, that would improvements to air traffic would be tremendous. In much the same way, WebRTC is designed to change the web so as we know it, because it eliminates the need to connect through a server in order to send data. Furthermore, WebRTC does not require any downloads or installations of software. It's a completely open platform. So how does it work? Well, the first step is establishing a voice and video connection between peers, in a sense computers, as they gain access to the microphone and camera on each device. Until recently, this wasn't possible with just a web browser. You had to install a program to do that. The W3C developed a simple API called the Media Capture API that has gained some support among browser makers. However, the Media Capture doesn't provide any means of streaming video or audio, so they developed a Media Stream API. The job of the Media Stream API is to ask the user for permission to access the camera and microphone and then create a synchronous video and audio stream. And just use it by using JavaScript, and JavaScript is a natural language of browsers. Once the media stream is created, WebRTC uses a peer connection API to communicate streaming data between peers, in a sense, the computers. Like a media stream, it employs a very simple interface. It just takes a media stream and sends it to another recipient, where it's loaded into a real-time peer connection on their end, and pretty much that's all there is to it. The whole framework is based on HTML5 and JavaScript, but it does not utilize SIP or H323. The signaling and transferring of data works over RTP with an XMPP extension called Jingle. With the newly introduced Java Session Establishment Protocol, direct connections can be established without the need of a piece of hardware in the middle. That means no gatekeepers, no servers, nothing like that. Depending on the deployment, audio, video, and or other data can now be exchanged to allow WebRTC to happen in your browser. And for, I don't know any of you who are firewall people, but WebRTC can do stun, ice turn, RTP over TCP, and also supports proxies. So what are the roadblocks currently to WebRTC? Well, there is a video codec debate. In a sense, should they use a VP8 or 9 or H.264? So to understand what each one of those codecs are, I'm going to explain a little bit here. VP8 is a video compression format created by Onto Technologies and owned by Google. So VP8 is owned by Google. It was open sourced by Google in 2010, but compared to H.264, VP8 is rarely used. But what is VP9? Well, VP9 is the successor to VP8, and it will be open sourced and available for free. I like free. But what is H.264? Well, that's a codec that you're probably more familiar with. It is a standard for video compression. It's currently one of the most common used formats for the recording, compression, distribution of high-definition video. H.264 is patented by the MPG-LA group. H.264 would be standards-based video conferencing, could use that codec as well. So what does WebRTC use? Well, the standards committee has chosen to use VP8 instead of H.264. Well, why VP8? And the reason it uses VP8 instead of 264 is, number one, VP8 is free. H.264, there's been licensing issues with MPEG-LA group. And again, that license, which I consider a bad word. Do either of those video codecs work on mobile devices? Well, both codecs can work on mobile devices, but to get true real-time performance and quality, mobile phones must have hardware to help decode the video. And Bob, I see your question about security, and actually that is one of my slides coming up. So again, the video codec debate. So the major interested parties, where do they stand? Well, as you can see, Google chooses VP8. Why? Because it's their platform. Mozilla, Opera, and then Cisco can go either way, VP8 or H.264. Some of the big ones, Microsoft and Apple, both prefer the H.264 standard, and Ericsson as well. So there is currently a debate going on exactly which codec to use. Browser issues. So with browser, do any browsers interoperate with out-of-the-box WebRTC? Well, yes. As of February 4th, Google and Mozilla announced interoperation between Chrome and Firefox. Mozilla released production support for WebRTC and Firefox on June 25th. In addition to desktop support, Google released support for WebRTC and Chrome for Android on August 21st. Chrome for Android interoperates with desktop versions of Chrome as well as Firefox. Next thing, is it possible to build WebRTC applications that interoperate across all browsers? Well, not at the moment. Firefox, Chrome, and Internet Explorer with the Google Chrome Frame plugin interoperate today. Unfortunately, Google recently announced that the Chrome Frame production will be retired in next month, January 2014. But what about Safari? Safari is the browser for Macs. Apple says staying quiet at the moment, so it's hard to know where they stand on WebRTC in general. WebRTC implementations currently don't function in Safari. So in regards, if you want a more in-depth technical analysis of exactly what WebRTC is, there's a YouTube video, which I have the link there, a presentation by Justin Uberti, who is Google's WebRTC tech lead. This is a very good in-depth, exactly what WebRTC is and how it works. So some examples of WebRTC. Well, it's almost impossible to count. Okay, especially in the age where it's BYOD, for those that don't know, it's bring your own device. Everyone has their smartphone always ready, and beyond that, every notebook and desktop PC could participate in WebRTC. I mean, here's some examples I could think of. Video conferencing, obviously, web collaboration, smart TVs, having a video diary if you have connecting up to a cloud recording, social media. I mean, I heard that Facebook is looking seriously into having a video chat feature. So WebRTC is definitely going to be changing the face of the internet and exactly what we do with it. So recognizing the benefits, what's a possible meaning for bringing back house calls? What can you do? Excuse me. If you're interested in using WebRTC in your organization, I would suggest that you start shopping around, see what companies are out there. The University of Utah Healthcare, just did just that. Lucky for us, we found a company in our own backyard. So as a warning, from here on out, I'm going to be talking specifics for WebRT Solution that Department of Telemedicine decided to use. So we decided to use a company called True Clinic to bring online healthcare to patients. Well, True Clinic is based here in Salt Lake City. Justin Kahn, which is actually one of the participants here today, is the CEO of the company. Okay, so to understand WebRTC, you kind of have to understand the University of Utah. So we have 4 hospitals, 10 neighborhood health centers, 200 medical specialists, over 1,000 board-certified physicians, connected to 78 non-university hospitals and clinics throughout the Midwest using telemedicine. We are an academic medical center. So what that means is that we have the School of Medicine, College of Nursing, College of Pharmacy, School of Dentistry, etc. Excuse me. We have specialty hospitals, Huntsman Cancer Hospital. We have a burn center. We have a Moran Eye Center. Since we have so many medical specialists and services, there is a definite need to extend those specialties and services out to remote areas. Are there any FDA issues? Well, True Clinic does not provide results. It is in diagnosis. It's only a communication medium with no clinical decision support. Therefore, it does not fall under the FDA. I do apologize. For some reason, the link color for links is a lighter gray on a dark gray background, so it's hard to see. Hopefully in the PDF file, which you can download on your right, should have a working link for you. How about compliance? The compliance, obviously, it is True Clinic is HIPAA compliant, High Tech Health Information Technology Act. It's also the PITA, I believe is how you pronounce it correctly, the Personal Information Protection and Electronic Documents Act, which is the Canadian equivalent of HIPAA, and the Children's Online Privacy Protection Act, plus much more. In regards to security, our ISO, so that's my Information Security Office, did an evaluation and bought off on the software. They believe with the method that it communicated the software, there was low risk of patient health information breach. So it was completely signed off with us. But, okay, we're connecting in, providers connecting in the patient's home. What if there's a problem? How is it going to be supported? Well, there could be patient issues, there could be provider issues. So we have to have some sort of a support mechanism to be able to address those issues. So what we have done, being part of the University of Utah, there is a help desk. The help desk is what providers, nurses, clinicians here would call if they have any type of issue, either with software or hardware. So what we have done is that we are installing a separate support phone number that will ring into our hospital help desk, which patients and providers can call specific to True Clinic connections. The help desk agents have been given, and we're going to be training them on scripts on different issues and problems that come up. Could be that they can't get their camera working, they can't get their microphone working. With patient homes, you're going to run into a plethora of different connection speeds, setups, the ability for people to understand how to log in on the internet. You could have somebody, a 7-year-old who is an absolute whiz, or you could have grandma who's very rarely used a computer at all. So with that huge variety of people, we have to be able to support mechanism to do that. So we're using a support mechanism that's already in place, just expanding it with our hospital help desk. Also providers as well will be calling the hospital help desk for support. So what are the patient benefits? Well, patient benefits, obviously, it's very easy to use. It provides accessible health care to the patient, to their home. I know with my wife, I have 6 kids, as was said in the bio. My wife, to have a doctor's appointment for her to go, or even one of the kids, is difficult, very difficult to pack everybody up, to take them to the clinic to be seen, especially since I'm at work. I can't necessarily babysit. If the doctor can connect directly into the living room, directly right into the computer, it saves her time, it saves her effort, energy, money, gas. It's definitely beneficial from a patient's point of view. And also it helps save money by keeping those who have minor ailments from turning into major operations. In a sense, readmissions. It's very efficient, and like I said, it saves time. Providers, there's a lot of very similar benefits on there, but it also offers insights not available during an office visit. If you remember a number of slides back, I listed, how can we bring it back that would have the benefits of the house calls, but also address some of the issues that cause decline. Well, I believe WebRTC, especially with True Clinic that we're using, definitely does just that. It's helps with reimbursement. Reimbursement now is much better. It has access to latest biomedical knowledge and technology, meaning the doctors still have full access to all their information from their own office. In regards to reimbursement, if anybody asks me concerning reimbursement, I am not the expert concerning about that. I would definitely pass it on to somebody else. But if you do have a specific question, you can always email me, and I could find the person that could have the answer for you. The institution itself, it obviously has benefits. Reducing, meeting the consumer demands, saving money, increased rural access, again, providing access to healthcare for patients. So how is TrueClinic being used? True, TrueClinic is currently being used with mental health providers, connecting mainly in the clinics. And the clinics are, or the patient, let me describe the workflow. The patient actually will come into the clinic. The specialists here at the University of Utah, then when using TrueClinic, connect into that clinic and be able to see the patient. Right now, it is not used in the patient's homes. The reason being is because the help desk is not completely set up yet and trained. We want to make sure that that infrastructure is in place and solidly working before we actually go in the homes. But outside of that, we are connecting into clinics, so mainly remote clinics that can get the specialty services, and there's a huge demand for mental health service. So this actually helps out everybody. It's used currently in the NICU at the University of Utah. So you're thinking, why in the world would it be in the NICU? I mean, the patient's right there. The patient's a newborn. How can TrueClinic be used? Well, there's an interesting story. What we had initially was a mother who was undergoing cancer treatment at Hudson Cancer Hospital. She gave birth to a newborn who needed to be in the ICU. So what we did is using Microsoft Surface tablets, installing TrueClinic, not installing, but using TrueClinic through the browsers with the Google Chrome plugin, IE, or Google Chrome itself on those. We connected in the mother and the baby. So that means the mother in the Huntsman Cancer Hospital was able to view and interact and see, and the baby would be able to hear the mother there. That was so successful that now we have it for the babies at the NICU. A parent at home or even a relative can, using TrueClinic, be able to connect in and be able to see the baby. So initially it was supposed to be used for a provider patient, but we're finding other uses for it, which has been extremely popular. So to summarize, there's going to be a projected increase in the elderly, high consumer demand, and hospital readmission reductions in regards to bring house calls back. There's a lot of benefits. Common benefits for patients, providers, and hospital is easy to use. It saves money. It stops the readmissions. It's efficient. It saves times and offers insights not available during a normal office visit. It allows developers, in a sense programmers, to really to write rich real-time multimedia applications similar to video chat with use web with no plugins, no downloads, and no installs required. It's free, open source, no licensing, currently supported by Opera, Google Chrome, Mozilla Firefox. It's important because it has better video quality than Flash. It has faster connection speeds, reduced audio-video latency, and it's native HTML5 elements. So that means it's going to be plugging in and it's going to just work. So imagine the impact of hundreds, or maybe even in your case thousands, of potential video endpoints to your telemedicine program. How many people you can reach is just mind-blowing. But it's not done yet. We have the video codec debate. In a sense, is it going to be using VP8? Is it going to be using H.264? Which way it's going to be going. I don't know if you remember the beta VHS issue or Blu-ray disc and HD discs. Sometimes there's competing technologies that go out, and then eventually one of them will grow and be on top. Okay. Browser compatibility. Right now, it's Firefox, Chrome for Android, Internet Explorer with the Google Chrome frame works today. But Google's going to be retiring the Chrome frame. So exactly what's going to be happening with Internet Explorer, we will see. Currently, it doesn't function in Safari, but we will see what the future brings with that. And I absolutely love this saying from Yogi Berra, the future ain't what it used to be. But what that means to me is that the future, we plan for the future. We try to anticipate the future. But things change. Technology changes so quickly that what we thought the future is going to be ends up being completely different down the road. So that's about it. Bob, did I answer your question about security?
You did, Brad. I'm just, I'm always concerned about open source being easily infested and easily violated. So I just wanted to be sure that it was HIPAA compatible and that we could secure provider to patient protected health information. So you got it, I think.
Yeah. Now, WebRTC, I wouldn't necessarily say is HIPAA compatible. TrueClinic is HIPAA compatible.
Okay, TrueClinic. Thank you.
Right. So all those, the HIPAA, all those things that it is compliant with is TrueClinic using WebRTC platform, not WebRTC itself.
Okay, yeah, that makes sense. And I want to thank you, Brad, for taking the time. Would you want to share your contact information if people have specific questions for you?
Oh, so I have contact information is here. It's also in the PDF version, and also Justin's with TrueClinic. If he has specific questions concerning TrueClinic, I would address those to Justin instead of me, since it's his baby, not mine.
And if anyone else has questions for Brad about today's presentation, go ahead and type them into the Q&A frame here, and we've got plenty of time to respond to questions. And as Justin just stated in the chat frame, contact him anytime too if you have questions. So we've got a lot of people that are more than happy to talk to you. And Brad, I just want to thank you. You've included two of my favorite people in this presentation, Yogi Berra and the Swedish Chef. So we'll hold on for a few more minutes for questions, comments. And if we don't see anything coming up fairly quickly, Martha will put a request for you to take a survey, put it right on your screen so we don't have to ask you to link over. I don't see much typing activity going on, so I think I'll just say, Brad, thank you very much, and I want to thank everybody for attending. And Martha, if you will invite them to take the survey, tell us what you thought of today's presentation, and tell us what you'd like to see in future webinars. We'd be very appreciative of your participation. Brad, thanks a lot. Thanks very much.
Okay, thank you.